This time we are going to Yawhimah Health Center, a community of about 1,000, and they only have about few hospitals with 3 beds. I don't know how you would feel if you live in a community where you are in urgent care of health and you are not able to get it in any way or form. This was filed by Michael Sapong Infum. That is our Bono regional correspondent. Let's go watch the report. When we are back, we'll have a discussion.
Basic things that will enhance quality healthcare delivery to the inhabitants. The facility has only 3 beds due to inadequate space. Plywood has to be used to create offices. Kwejo Ade is a senior physician assistant in charge of the facility.
The facility was built 11 years ago, and by then the community was very small. As we speak, the community is having about close to 10,000 population, and the facility can only boast of 3 beds. The 3 beds at the emergency unit accommodates males, females, children, whatever, everybody. Just 3 beds. Catering for a community of close to 10,000. So space is of much needs for the community or the health center. We need space as soon as possible to be able to provide the needed health care. And we also need frequent water supply. So I will plead we get mechanized borehole so that we can get 24-hour water supply. As we speak, we are linked to the national grid, and as we all know, for about a day, 2 or 3, sometimes a week, there might not be any water flow. And it comes that way, it's very difficult in terms of cleaning and other things. And we can all imagine what will happen. A lady going to deliver without no water flow, it will be very disastrous. And that's what we have been experiencing over here. So we will plead we get a mechanized bowl, so that we can get frequent water.
Midwife in charge of the facility, Gifty Yesazoy, has been shedding more light on the challenges they go through in the discharge of their duties.
The main challenge we are having right now is the space. As you can see, we are using the same room for the ANC and at the same time the line in. So when somebody delivers right now, we have to bring the person here. Meanwhile, it's supposed to have a very quiet environment, but we'll be sitting here doing the ANC at the same time. So that is the main problem we are facing. And then again, there are certain things too that we don't have. We are supposed to have an incubator and then a portable scan that other midwives are using. But here we don't have it. So when we encounter a complication, we have to refer to regional hospital. And then there are some medical equipment that we don't have. We are supposed to have an emergency pack that contains emergency drugs to manage certain conditions. But when I came here, we don't have that.
Sam. The chief of Yawhimah, Nana Nsuabebio, on his part said he has made land available for the construction of a new health facility in the community.
How dare you have a bio clinical? You say, but I must see clinical, and I couldn't see. You grab a nice to the school that I mean, and I money see. Ibuya, Elena, in yes, as we are near mom, so many see clinical. And only say, I feel dear child, yes, something. Contra Netrico, as a funeral choke. To be up as I say, Manoba. The Yana and men pay for a dream say, Neo Bola Bisu, a church, Bola City Bola, and Melbourne, a Sabana Banner a truth. They be what do was a bit my boy. Kakrin creating Fanko. Na is a Nippon Hanon. For Crono, say, meet Macasay, population and Nipadu Kohano, Yabro, but to do back.
Just as you watched, I was also watching here with my colleague, and It's disheartening that a population of 11,000 people, but for the chief giving them a land for expansion, that means nothing is being done by government.
Exactly, and you know, it's not just one problem that we're looking at. We're looking at so many
A
problems.
variety,
There's
water
even issue of
supply.
water. And how can there be a health center and have water issues?
We have Kojo Adai. He's a senior physician assistant for Yawhimah Health Center. Kojo, you're welcome. Good morning.
Thanks for having me.
I mean, we've seen a general overview of the problems facing Yawhimah Health Center. So far, the chief has been able to give a land for the expansion, but the immediacy, the urgency, what is being done so far by government, by any other intervention?
So far, we are putting a couple of letters around. We have visited some philanthropists, and we are looking forward to what will happen in the future. But as I speak, nothing is done yet.
There's no borehole at all that is helping to service the hospital.
Exactly so.
Has this gone to the assembly in any way or form? The chief has done his part, but definitely now you have to refer to the general hospital, because I know it's in Sunyani East. So that means you're going all the way to Sunyani, you're traveling all the way to Sunyani. If there's a pregnant woman, she's in labor, how are you able to manage this?
So you see, this thing, the chiefs are aware, our assembly rep is aware, our director for health for the municipality is aware. So it's like almost all those that are concerned are aware. And you know, our assembly man is part of the assembly. We report issues affecting everybody. Our director is also part of the assembly. We meet most of the times. So it's like all the things happen over here. All the stakeholders that are supposed to be aware are aware, including the minister, the MP for the area.
The MP for the area is aware. The assembly is part of the community. That always takes the problems to the assembly. Yet,
Exactly.
like I have learned in the past years, that there's always a support that comes from government, which is the Assembly Common Fund. If it's coming, is there a way that it is used to support in any way?
That one, when it comes to
I
money
wish we could
issues,
speak to him, yes.
that
Now,
when it comes to money issues from assembly and how it's being displayed, I don't have much to say about that. But my issue is that I'm only pleading. If it's coming from assembly, fine. If it's coming from philanthropic fund, I'm only looking forward to the issue being tackled.
and how many years has this been going on?
The facility was established more than a decade. As I speak, exactly 11 years ago. And this is what has been going on since when the facility was started.
Has there been an appeal to any NGO at least?
I took over this year, and I don't know what my predecessors have done. I took over this year. And as part of measures to make sure that this is tackled once and for all, that's why we are coming to the general public, writing letters to the various stakeholders, and engaging the chiefs, the assembly reps, and my director, and whoever is involved to make sure it is tackled. I cannot talk of what the predecessors did, but I have sent to make the issue, and I have to make sure I do my possible best to make sure it is tackled.
All right. Mr. Adai, what are the primary healthcare services offered at the Yawhimah Health Center?
Ranging from OPD services, antenatal, postnatal, deliveries, we offer laboratory services, dispensary services, mental health services, we offer health promotion activities over here, nutrition activities, HIV, AIDS clinics, tuberculosis these child welfare clinics, what they normally call we, they offer all these things. Even as I speak now, there's one session ongoing.
All right. So let's just say there are around 10,000 people in that area, but you have only 3 beds at the health center. So how has the limited bed capacity affected the quality and care that you provide for the people?
The issue is that because of the bed capacity we have now, there are some of the clients like you could have detained for some time and attend to them very well. But sometimes in a day you have to detain about 200 or 300 or sometimes 400% of the number of beds you have over there. So in that case, you have to hasten things for the person to go in order for you to get the bed for another person. Sometimes you are forced to refer a case you can manage to the to either the district hospital or the teaching hospital. There are some of them you refer, and the next hour or two you still see them around, and the next day you will still visit the facility again, because it's not all of them that if you refer financially they have the model to go to teaching hospital or the district hospital. In that case, you are trying to get more attendance. In actual sense, because you are not able to provide the quality of care. That is why we are coming repeatedly. Why it is that you have the chance to attend to the patient and completed the full treatment regimen. Maybe the person might be coming in some 3 months, 6 months later. But because there's no space for you to cater for the person and make sure the person is fully recovered, it makes the attendance to the facility keeps on repeating itself, and it will be like you are getting better attendance. But in actual sense, it is the treatment that is not doing well.
Right.
And some of them, if you refer them because financially they cannot do, it's not all of them who will be able to come back again.
Yes. So
because you have referred and the person failed to go to the biggest facility you refer to, if the person is having the signs and symptoms of the condition again, the person is afraid to come because the thinking is that I went there, I have been referred. So if I go back, I don't know what you say to me.
Right. Anyway, thank you so much, Mr. Kojo Adai, who is in charge of the Yawhimah Medical Center. Thank you so much for speaking to us. And I hope and pray that the center gets the needed help that it needs right now.
Thank you. Thank you very much.
Okay.
Thank you.
We all pray for the future to be brighter than it is right now.
10,000
because health
people?
is major. 11,000 actually.
11,000 people and just 3 beds?
Just 3 beds for an entire community. That is servicing an entire community. And that is why it's sad if they are not receiving the needed care that they request, especially for women in labor,
and we just
for a stroke patient,
and
for somebody with a heart attack.
We just turned 67. That was yesterday. And there are people out there still struggling to get clean water. And there are people out there still trying to get the best of health care. And somehow we are happy celebrating 67 years. I really hope these communities get the needed help. If you're out there and you're touched by any of these stories, I mean, you can reach out to us if you want to help. And yeah, for those in charge, you will be accountable someday. All right.